My name is ZaherSahloul. I'm a pulmonary and critical care specialist. I'm also the president of MedGlobal. That's the best thing that I had in my life, actually. This is my third trip to Ukraine. My first visit to Kyiv. It's a beautiful city. People are welcoming, hospitable, energetic to learn. We're doing training on chemical weapons preparedness. This is something that we had to do in Syria because Syria witnessed the use of chemical weapons more than 345 times. So this is our fifth training on chemical weapon preparedness, second in Kyiv. We did 3 in Lviv. And the idea is make sure that our colleagues in Ukraine are prepared in case that something like this happened, God forbids. But this is a war situation. There are all kinds of threats from Russia about the use of unconventional weapons, and Russia has used chemical weapons to assassinate political figures in the past, and they may use it in Ukraine. So we want to make sure that our colleagues are prepared, planning well. They understand what different classes of chemical weapons, how to detect them, how to protect themselves, how to decontaminate patients, and how to document the use of chemical weapons. My experience so far has been amazing. I mean, the fact that every person here is appreciative of the fact that we are coming from the United States to be standing with them. The attention, the eagerness to learn, and the stories that I've witnessed, which is more important than the training itself. Every person I meet, they tell me the story of resilience, of resistance, of determination to win this war, and this is very important to me and dear to my heart. I mean, I want to tell the world is that the fact that the Ukrainians are very determined to overcome this war in spite of the brutality, and that they're dignified people. They are very brave, courageous, and collectively they are fighting one of the most powerful armies on earth, and that we have to stand with them. And they also appreciate the attention and the aid that they are receiving from the United States and other countries. They deserve to win this war, and they deserve for us to pay attention to what's going on in Ukraine and keep standing with them in solidarity. My hope that the war ends as soon as possible. War is terrible. War is the enemy of health. So Ukrainians and others, of course, there are other wars in the world, focus on rebuilding their country and improving the healthcare for everyone, and also using this opportunity of disaster, but at the same time world's attention to improve healthcare in different hospitals in different regions. I mean, MedGlobal was started in 2017 by a group of humanitarians, doctors and nurses out of the experience in Syria. I'm Syrian American, and in Syria we had brutal war where hospitals were attacked, where doctors were killed, where chemical weapons were used more than 345 times, where people were put under siege. It was the worst refugee crisis in our lifetime. 1 out of 4 refugees in the world is from Syria. There's still 6.5 million Syrian refugees. And what we have learned from the Syrian crisis, we wanted to apply it at the global level. So when we started MedGlobal in 2017, there were 3 major humanitarian crises: Syria, Yemen, and the Rohingya refugee crisis. And we started by sending doctors and nurses to provide health care. And out of that, we grew gradually. And last year, we were able to impact 9.8 million people in 13 different countries. We do 3 types of programs: emergency response, sustainable medical programs, and building resilience within healthcare systems. And it's very fulfilling work. I'm a full-time practicing physician in Chicago, like most of our volunteers. We have full-time job, but this volunteer work is more fulfilling, and it impacts many people. We always bring good stories about the people we have seen in Ukraine and Syria and Yemen and Palestine and Bangladesh and Colombia, and that will stay with us in my heart and the hearts of the volunteers for the rest of our lives.